Actually, wait up for me here 1 minute, guys. I just gotta take care of something. Okay, sorry for the technical difficulty. This is Ed Crow. I'm going to get us started there. I was having a problem recording the webinar, which I like to do. So thanks for joining today. Today we're going to talk about Medicare Advantage versus Medicare Supplement, but not just the difference between the two. We're going to talk about using it as a sales strategy. So we're going to go over that today. A couple quick things before we start. We do record all our webinars. That's what just slowed me up there, was I was having trouble with the recording. So we record all of them. We will send it out to everybody that registers. So for future reference, if you want to watch one of our Wednesday or Thursday 1 o'clock webinars, but you can't make the time, or maybe you're out west, simply register for it and you'll get the recording. The other thing is, if you have questions, just ask them in the question box down below, and I will answer them at the end. On occasion, I do try to answer them as I go through the webinar, but I am not skilled enough to do that, and just easier, I think, and better for everybody if I wait until the end. Having said that, we're going to talk about Advantage versus Supplement, using it as a sales strategy, and we're going to go over more or less best practices of how to talk to somebody about Advantage versus Supplement when you're describing it and talking to a client for a sales appointment. So we'll go over everything. First of all, reviewing how you operate, how much you get paid, the goal of the meeting, Medicare A and B, explaining the options to them, that they have two options, going over the differences between the two, rules then for enrollment and making changes, and then educating them enough to actually make a decision as to what they want. So the strategy here is to talk to them, educate them enough. It's really just an education. It's not even a sales pitch. Educate them enough and let them decide which option they want, and then makes it easy kind of from there. First thing you want to do when you have an appointment, and I certainly would forget from time to time to do this, but it's important to explain how you work and how you're going to interact with them. As agents, we assume that they know, but they really, most people don't know. So first thing I would do is talk to them about how you get paid. Oftentimes you'll have these appointments and people will think that you're going to, at the end, say, oh, you owe me X amount of dollars. So it's a brief explanation, just saying, this is how I get paid. The insurance companies pay me, so it doesn't really matter. My goal is just to put you in the best plan possible. And the insurance companies pay me, so you're not going to owe me anything. Explain to them you work with multiple carriers. So the goal of the meeting today basically is to help them understand what they need to do to get set up on Medicare A and B, and then to review with them the difference between a Medicare Supplement and a Medicare Advantage plan. Go over the pros and cons with them and help them determine then which one fits them better. Once you do that, then you're going to find the company that works best for that type of product, because you're independent and you work with multiple companies, and you'll get them set up. Also, make sure you mention to them that you will follow up with them every AEP, prior to AEP, and just see what's changed on their plan, how their experience was with it. If anything really, any new killer plan comes out, you'll talk to them about that, or if their current plan had negative changes, you can review that and see what else is out there. And also I would throw in there, but certainly you're not obligated to make any change if you don't want to. It's just a service we'll offer. Quick note about this strategy. It's more for if you're talking to a T65, it's for referrals. It's really more of a strategy, a more rounded strategy. If you are talking to somebody who's obviously a dual client, or they tell you clearly they're a dual, or it's really obvious right from the beginning they want to supplement, you can skip most of this, quite honestly. I've learned you don't paddle upstream. So if you're doing telesales, for example, and you're working with mostly duals, this strategy probably isn't the best fit for that. Again, it's more for T65s, face-to-face meetings, referrals that you get, and people that really kind of want to know the difference between the two types of products. So the meeting starts, meet with the person or talk to them on the phone. I I myself and a lot of other agents use this both in person and on the phone, so it works either way. Tell them how you operate, as we just discussed, and then give them a quick explanation of A and B, because there's a few things they're going to need to know when it comes to Medicare A and B. The first one, the simplest one, but the one they usually don't know, in fact, is how to sign up, when and how. Keep this as simple as possible. Believe it or not, a lot of people don't even know that they're going to sign up for the first of the month they turn 65. So they'll say, well, I'm a November 23rd, and you got to explain to them, no, it always defaults to the first of the month. The only exception to that rule, and I've kind of forgotten this once in a while, is it's not the first of the month if their birthday actually falls on the first. So if somebody's born July 1, that's their date of birth, July 1st, their Medicare is going to start the first of the month before. So that person would be a June 1. So just something to remember. Of course, you want to explain to them, one of the first questions I would ask them is, are you already collecting Social Security payments? In today's day and age, it's changed over the years. It used to be when I would ask that question, these people were turning 65, they almost never were. But now more and more you see people who started taking it, Social Security 62, 63, whatever it may be. So you ask them that question, because the answer is for them, if they're collecting Social Security at the time they turn 65, it's an auto enrollment for A and B. So you can let them know that. You don't need to do anything. You're going to get Medicare A and B automatically because you're already taking Social Security payments. If they're not taking Social Security payments, then it's a manual sign-up process. This is what people used to do, or why people used to go down to the Social Security office. I mean, a lot of them are still closed at this point, but they go down to the Social Security office and sign up for A and B because they're not drawing Social Security and they need to manually sign up. You can do this online now. And what we do is we just would send the link out to them for them to sign up for Medicare A and B online. Next step after you explain that would be explaining the cost of Part B. Explain to them the standard Part B premium, $148.50. And then you can kind of feel this out, but the IRMA conversation is needed. So if you have higher income earners, they need to know. This can make an appointment go really bad after the fact. They need to know about IRMA. So IRMA is applicable to Part B and Part D. So I recommend having the one-sheet grid. Right now it's the 2019 income to determine the 2021 IRMA, if there is one. Have the one-sheet grid for Part B and D, because I always forget the amounts. So you can explain to them, if they're higher income earners 2 years ago, then they're going to have an IRMA penalty. We're not supposed to call it a penalty. They're going to have IRMA, income-related monthly adjustment amount. So after that, you'd provide them a simple explanation of A and B benefits. Keep it simple again, and explain to them that their Medicare card, their original Medicare card A and B, is an insurance card. People really don't get that often. So I usually give them examples, and I'll say, that card is an actual insurance card. It's a government insurance card. Explain the A's for the hospitalization piece, and then B is for all other medical services done outside of the hospital. And again, I use an example. So I say, if you go to the doctor, you show them your A and B card. B's after your Part B deductible, B is going to cover you at 80%. Same thing if you go in the hospital, A is going to fall, and you just have this card. You're going to have Part A is going to be the hospitalization. Sometimes I explain the deductible. Sometimes I just say to them it's just 80% coverage. Up to you how much detail you want to get into there. So you're giving them this explanation so you can point out the need for them. So once you cover the A and B cost share, you explain to them, and there's no cap on the A and B cost share. So that 20% is unlimited. So if they go into the hospital 3 different times outside of that 60-day benefit period, you're going to have 3 hospital deductibles. And if they have tons of Part B services, there's no cap on what that could cost. So you're going to say, so the first thing we're going to address, or people address, is how do I cap some or all of the cost on that A and B doesn't cover? And then finally, how do I get prescription drug coverage? So those are their 2 things that we need to address in this meeting. And then I break it down with options. I try to say you have 2 main options to address those 2 needs. Option 1, and I always say option 1 and 2 so they can kind of differentiate between the 2. I'll say option 1 is keeping original Medicare, so that Medicare card that we just talked about, keeping that as your primary insurance, meaning when you go to the doctor, the hospital, the lab, they bill Medicare. Then you purchase what's called a Medicare supplement. Oftentimes I'll reference like AARP's name or something just to help them recognize. So Medicare's primary, you pay for and buy a supplement that's going to cover that 20%. And then as we mentioned, Medicare A and B doesn't cover drugs, so you buy a standalone drug plan. We're going to talk about that. That's option one. And then option two is doing something completely different. That's called a Medicare Advantage plan. So let's go over both of them and see which one you think fits better for you. So for option one, the way I would explain it to them is I would say you're leaving your Medicare as your primary insurance. And that example I just gave a minute ago, you do the same thing. It sounds obvious, but they don't understand. So again, you tell them, you take that Medicare card, your doctor, your hospital, any medical practitioner, they're going to use that as your insurance and bill it. So you're leaving it primary. What's left over that Medicare doesn't cover, you're going to buy a Medicare supplement to cover what's left over, that 20% we were talking about. And then you'd buy a drug plan, doesn't have to be by the same company. You'd buy what's called a PDP, a standalone prescription drug plan that's going to cover your medications. And again, reiterate to them how it works a couple times. And one question a lot of people will have that we don't think about is they will think, well, once Medicare covers their portion, my 20%, do I have to send that to my supplement? And tell them, no, it's automatic claims adjudication, meaning you don't do any paperwork. Doctor bills Medicare, Medicare covers their piece, and automatically sends the rest of the supplement. Okay, and again, your standalone drug plan does not have to be the same company. A visual aid, if you're in front of them, is helpful here. There's a number of companies that lay this out on a sheet, or you can explain it to them over the phone, or you could email them or do a screen share. But a visual aid will help with this. So I explained to them how option one works, and I explained to them you have three premiums in this option: Medicare Part B, the supplement, and the drug plan. Make it really simple and lay it out. Then I'll go into the positives of why somebody might go this route, option one. First of all, it's because Medicare is primary. You have no network. So you go to that doctor, the hospital, wherever you go, all they care is that you have Medicare as primary. If they participate with Medicare, which is every hospital in the United States right now, it's 97, I forget the exact number now, but 97% of the physicians. They take Medicare, that's no problem. It does not matter what supplement you have. And I'll even say you could have Ed Crow's supplement. It wouldn't matter. So there's no network with supplement. Your only network, so to speak, is that they participate with Medicare. So whatever company we use for a supplement doesn't matter. It won't interrupt. It makes no difference which company you use when it comes to accessing doctors. And I'll say to them, a supplement's considered more the Cadillac coverage, so it can greatly limit any potential out-of-pockets. And when I do this, I'll focus on Plan G or N, and I'll give them an example. I'll say, well, for example, on Plan G, everything Medicare approves but doesn't cover, the Plan G, you pay a $203 deductible, and then you're covered in full medically for the rest of the year. Just try to make it simple for them. Other positives are very little managed care. So unlike your group health insurance plan you might be on right now, you don't have to deal with prior authorizations, or not many of them anyway. And I'll use a skilled nursing example. On a managed care plan, they're going to try to get you out of that skilled nursing facility as soon as possible, meaning the second you're not showing improvement, they will have you out of there. You get a little more leeway on original Medicare and a supplement. And then the other positive is you can pick a drug plan. And I'll say, for example, if I'm in Connecticut, there's 24 different standalone drug plans. We can pick the one that fits best with the medications you take. Then I'll go over the negatives. And I'll say, so the biggest negative is you're paying three premiums. And I reiterate, you're going to pay three of them: original Medicare, supplement, drug plan. I'll explain to them that, sometimes I'll put this in, sometimes I won't. I leave that up to you. But preventative can be an issue. As you know, original Medicare covers your Welcome to Medicare physical, being kind calling it a full physical, but they cover that. But after that, it's just a wellness visit every year after that. So if a doctor's office isn't savvy about it, and they just bill, black and white as they're supposed to, when that person has their annual physical, they're not going to have much covered. If the doctor runs a bunch of tests and things, Medicare's not going to approve that, and the supplement's not going to cover it if Medicare doesn't approve it. Now, a good doctor knows how to bill that through his diagnostic to get all the tests done that they want, and that way that physical gets covered. But not every doctor's office knows how to do that. And again, just clarify with them and make it make the point that if Medicare doesn't approve something, the supplement won't cover it either. Okay? And then the other negative is, as far as extra benefits that you see Joe Namath talk about on TV, and I reference Joe Namath's name because everybody knows those commercials pretty much. Supplements, while they're really good medical coverage, they don't do those extra benefits like dental, routine vision, over-the-counter transportation. So those are the negatives. Lastly, I'll give some examples of people who might be a good candidate for a supplement. That helps them understand this better. I'll say somebody who goes to the doctor a lot, or somebody who goes to a lot of doctors or doctors in multiple states. A supplement might be a good idea because on an Advantage plan, it might be hard to match up the network. And on a supplement, you don't have to worry about who the company is. As long as they take Medicare, then you're all set. You can just go. So somebody who sees a lot of doctors or doctors in multiple states, a supplement might be good for. Anybody who receives a lot of medical care, high volume, going to the doctor all the time, hospitalized a lot, whatever it may be, they might be a good candidate for a supplement because they're paying their premium and they know what their out-of-pocket's going to be. Plan G, $203 deductible, and you're done. People that get a lot of Part B injections, that's big. On Advantage plans, that's an 80/20, 20% cost share. On a supplement, it'd be covered in full. And then the other thing, lastly, I'd say somebody who just doesn't want to be bothered with details. So you get some people who say, I don't care what I got to pay, I just don't want to deal with network copays, that kind of thing. Okay, great. So I'll give them some examples of who a good supplement candidate might be. Then I say to them, okay, forget everything we just talked about. Now let's talk about option 2, your other option, which could be an Advantage plan. And I will explain, I won't do it in the detail I might do on a call here, but I will explain how it's a completely different setup. And I will say to them, when you take an Advantage plan, and a lot of times the people you're talking to have been on an individual or a group plan, I'll say it's very similar. It operates very similar to your group or individual plan. So when you take an Advantage plan, Medicare is not primary. You still pay for Medicare. You still pay that Part B premium, but you're not using your card. And again, an example helps. So when you go to the doctor, the hospital, the lab, wherever you go, you don't show them your Medicare card because they're not billing that. They're billing the Advantage plan. And I'll just explain that to them, just like they would bill your individual or group health plan. And just like your individual group health plan, this Advantage plan, instead of the Medicare benefits with 80/20, you don't follow that schedule. You're going to pay whatever the Advantage plan says you're going to pay. So it'll have a list of copays, like you mentioned. You have an individual plan. It'll have a list of copays just like that, and your drug benefit will be included. So Part D is built into your Advantage plan. And I'll give an example of that. Like I already said, you go to the doctor, you show them your Advantage plan card, which will be by a carrier, an insurance plan, an insurance company. I also always remind them that they're going to still pay their Part B premium. They like to try to forget that or assume that by you saying there's no additional cost that they're not going to have to pay Part B. So I remind them a couple times. So with option 2, then, I kind of lay that out for them, and then I explain the positives. So instead of paying 3 premiums like we mentioned in option 1, for Part B, the supplement and the drug plan, in option 2, you're only paying 1. This is assuming you're putting them on a 0 plan. You're only paying the Part B premium. That's it. Your RX benefit is included, so you don't have to buy a standalone plan. The RX is going to be built into this plan, and it's, by the way, going to be just as good as the one you buy on a standalone basis in option 1. You just don't pay for this one. Advantage plans give you the extra benefits you see Joe talk about. Dental, vision, we can match that up. Whatever's important to you, there's probably an Advantage plan that has those benefits. And then lastly, like a group health plan or an individual health plan, there's an out-of-pocket max, meaning if you have a catastrophically bad year, the copays on these plans are very reasonable, but if you have a terrible year and you're just getting tons of care all year, there's an out-of-pocket max, meaning if you've paid, once you pay up to a certain amount of money for the year, you're done paying for the year. And I'll frame it like that. Then I'll go into the negatives. Negatives are the plans are network-based, and I will say these plans, some of these companies have substantial networks, so network probably won't be an issue, but nonetheless, there is a network. And if they bring up PPO, I'll say, well, yes, PPO will let you go out of network. However, you're going to pay a lot more than you normally would. And some doctors might say, we know you have a PPO, but we don't want to see you, because that does happen, by the way. And again, you explain to them negatives are copays, very reasonable. They're not, high copays, but you do enough of them and they can add up. Other negatives would be that the fact that if they're not in a guaranteed issue state, they might not be able to move to a supplement down the road if they have health conditions. So you got to bring that in. When you're in one of the, which is most of them, one of the non-guaranteed issue states, once they're on that plan for a year in most states, their health goes really bad. They call you and want to go on a supplement. They're going to be subject to underwriting. They're not going to be able to get one, except obviously during a trial right or a guaranteed issue state. Your guaranteed issue states are Connecticut, New York, Massachusetts, and Maine. And your birthday rule states are California and Oregon. So birthday rule states, you do get guaranteed issue 30 or 60 days within your birthday. So I'll explain that to them. So the state you're in makes a difference. But the point is, you could be in an Advantage plan and down the road want a supplement and not be able to get one. And then lastly, managed care. Medicare Advantage plans are managed care plans. They're insurance companies, so you're going to have a little more prior auth than you normally would. In skilled nursing, if you go in there, they're going to be pretty quick to get you out of there if you're not showing improvement. And then just like with the supplement option 1, with option 2, we go over who might be a good candidate for an Advantage plan. And, obviously healthy people, the person who says, hey, I rarely go to the doctor, I go 3 times a year, perfect candidate for an Advantage plan. Why pay the premium for the supplement and drug plan if you're not going much? Obviously, dual eligibles or somebody who's not a full dual but a QMB, somebody who just maybe goes a fair amount to the doctor but doesn't have many doctors, the math will probably still work there. And this one's kind of a surprise to some maybe, but believe it or not, people with high net worth often like the idea of an Advantage plan because even though they have a lot of money, they often want to save that money. And the way they look at it is, why lay out money for a supplement and drug plan? They can take the advantage. If they're relatively healthy, they're not going to be laying out that premium. And if they do get caught with a bad year, cash flow isn't a problem. They can easily afford to pay the copays up to the out-of-pocket max. So don't just assume people with money always want a supplement. That's not the case. Oftentimes, in fact, they might want an Advantage plan. And then a good candidate really is anyone in a guaranteed issue state. And they're a good candidate because they can get a couple good years out of a supplement, their health, or out of an Advantage plan rather. If their health goes bad on them, remember, every January they can switch, and they can also switch during OEP. So guaranteed issue states, a lot easier, less conversation to have. They might want to be quick to jump and try an Advantage plan because they can always get out of it down the road. So once you go through that, then you explain to them the rules of changing plans, which we kind of just talked about. But I would, again, with a consumer or prospect that doesn't know this well, which most don't, we give them too much credit. I'll explain to them, every year we'll contact you prior to AEP, and that's your time where you can make a change. And we'll review the AEP rules and the OEP rules with them. Make them very simple. I explained to them that if they happen to be in a non-guaranteed issue state, explain to them that, you take an Advantage plan, you've got the 1-year trial right in most cases, for the 2 scenarios, if you took an Advantage plan when you first turned 65, or if you took an Advantage plan after you were only on a supplement, you got a 1-year trial right, but after that, your health goes bad on you, you might not be able to switch to a supplement. So you got to make that clear to them. And then if you're a guaranteed issue state, obviously you say, every AEP, every OEP, you have the opportunity to switch regardless of your health. After that conversation and you talk and you probably get some feedback from them along the way, you're just going to get their opinion. They'll probably, in most cases, they've already given it to you by now. Which option, 1 or 2, is more appealing to them or fits them better? Regardless, when they do decide, or if they can't decide, then you just kind of discuss it. Rarely did I ever have somebody who couldn't decide one way or the other. So anyway, once you determine that, then you'd find the Advantage plan that fits them best. Obviously, check benefits, docs, and meds. Or you find the supplement that fits them best, and you just price out a plan GRN. Pretty easy process. You're allowing them to make the decision, even though you're kind of walking them to one. And it helps cut down on the, well, you told me this or that, or you said this was the best. No, we talked about it, and you decided you were going to give an Advantage plan a shot, or you just wanted to go on a supplement. All right, a couple final thoughts here. I went a little longer than I normally would. A couple final thoughts here. A visual aid can help, like I said, for in-person meetings or phone calls too. Easily can use like a screen leap for a free screen share, or you could just email it to them. It certainly can be done over the phone, and it is without a visual aid. You don't have to have one, but it doesn't hurt. Know your 2 trial rights. The first one is somebody when they turn 65. They go on Medicare at age 65. Trial right doesn't work if they get Medicare at 66 or 67, due to loss of group coverage or something. But they get Medicare when they turn 65, and their first plan is an Advantage plan. They have a 1-year trial right where they can switch back to a supplement. They can switch to a supplement rather than drug plan the first of the month for the first year, the first of any month for the first year using their trial right. The other trial right to know, and I used to use this a lot, is if somebody's had nothing but a supplement since they've been on Medicare and they want to try an Advantage plan for the first time, they have a 1-year trial right. So the first of any month, if they don't like that Advantage plan, they can switch back to a supplement. I used to use this a ton. People who were hesitant to try a Medicare Advantage plan, I'd explain that they had a trial right for a year, so they had a 1-year free look basically. And if they wanted to stay on the Advantage plan, wonderful. But if they didn't like it and they called me 2, 3, 4, 6 months later and said, hey, I don't like this, I want to go back to my supplement, I'd put them back and then I'd get paid for it. Have a low-cost supplement option. I think that's important. Sometimes you get somebody who doesn't want a network. They love the idea of a supplement, but they don't want to pay for a plan GRN. Make sure you have a go-to plan high G or a plan K that you can go to and use that for somebody who wants full access to doctors but lower premiums. High G or K works really well there. High G works well to switch supplements too. But anyway, just a couple tips there. So that's it. I want to see if we have any questions. Keep in mind, we will send the recording of this out. But that essentially is when I would do all my sales appointments, that's what I would run through with people. Again, unless it was blatantly obvious that they were a dual from the beginning, or they just wanted Advantage, or they wanted supplement, then I would kind of, skip a lot of this. But otherwise, if they came as kind of an open book and didn't know a lot, which was usually the case, going through this kind of system worked very well and still does today. So let's see if we have any questions. Hi, did you say we were getting the slides? I'm going to send you out the recording. If you want to email me separately or email our office, I'd be happy to send you the actual PowerPoint if you'd like. No problem. In California, with the birthday rule, can you move from an Advantage plan to a supplement plan, guaranteed issue, no underwriting? Yes, is the answer. Do you have visuals to share, or do we just use the Medicare New book? Use the Medicare New book. That's exactly the visual I'm talking about. I forget what page it is, but one page of that book, Medicare New, or the UHC Clarity book, or Aetna has one too, but they all have a page that shows original Medicare A and B and the picture of the card. Then it shows right underneath it a supplement and drug plan. And some of them say option 1 or, supplement drug plan setup. And then on the same page is an Advantage plan. And you can use that to talk through this whole thing. Let's see if we have any other questions here. Those are good questions. Let's see if we have any others. Doesn't look like we do at this point. So, all right, well, I appreciate you joining today. Again, we'll send the recording out. And thanks for coming on. If you have any other additional questions, feel free to give us a call. Okay, I got a couple more quick questions. Could you do some training on the telephone script compliance? Yes, that'd be fine. I'd be happy to talk to you about that. And somebody said, can you talk more about K? I'll probably wrap up just because I've got a lot of people jumping off now because we're at the end. But yeah, Plan K supplement, I'd be happy to talk to you about it. If you want to just give us a call or shoot me an email, and I'd be happy to give you more information about the Plan K supplement. All right, well, thank you for the questions. Thanks for coming on today, and I hope everybody has a great weekend. Thank you.